Hello everyone, good afternoon and welcome to another live session organized by EDUKO Pathways Bangladesh. EDUKO Pathways Bangladesh is a leading education consultancy organization who have been relentlessly working to make the higher education dream come true for its students here in Bangladesh. We mainly work with top destinations, UK, USA, Canada, Malaysia, Dubai, Australia and some destinations in Europe. And today we have with us is a university from Malaysia, and we are doing a very specific program based live today because we think this is a very right time for you to do so, to know about this program. And as per the World Health Organization, there has been a huge shortage of doctors in the world, and we want you to know about the MBBS program at University of Cyberjaya, which is located at Cyberjaya, Malaysia. And from there, we have Ms. Dr. G.M. Kibria, Associate Professor of Anatomy, University of Cyberjaya. Good afternoon, Professor. How are you?
I'm fine. Good afternoon also.
Thank you for joining in today.
Thank you also. And I should thank EDUKO Bangladesh for organizing this type of presentation. And also I should thank Sharjah, the prominent figure in Bangladesh, I think, regarding this higher education for the students. Anyway, I think we are a bit late, but still I have to start without wasting the time. So first of all, let me share my slide. But before that, let me say one thing. After this discussion or this session, you'll be able to have a short overview, not in details, if not in details, a short overview about the University of Cyberjaya. And also, you'll be able to know about the MBBS program at our university, that is University of Cyberjaya. And the most important thing is that academic requirements to be students of University of Cyberjaya for the MBBS program. So these are the main objectives we'll learn today. And other than this, of course, you might have got some answer for your questions regarding the interview, type of interview, what type of questions asked during interview. And another important one is the scholarship opportunities, because finally we are always concerning about this economic condition. So that scholarship opportunities, how much it is possible. I hope we'll able to discuss or learn about these objectives today. So now let me share my slide. But before that, let me introduce myself. I am Dr. G.M. Kibria, Associate Professor of Anatomy, and I am working in Malaysia in different universities for the last more than 10 years. Recently, I have joined in University of Cyberjaya, and this University of Cyberjaya started in 2005 as the CUCMS, that is the University Medical School, University School of Medical Science, and now it is a full-fledged university. Okay, now let me share my slides, okay?
Sure. And meanwhile, while Professor shares his slide, I would now like to ask our viewers, if you have any questions, do write that in the comment box, because we hope to answer them at the end of the session once the presentation is over.
Okay.
Hello, Shiva. Thank you.
Dr.
Professor, we have Mr. Shiva Balan Krishnan, who is the regional head for University of Cyberjaya, who has finally managed to join us because of some technical issues. Shiva, thank you for joining in today.
Okay, Prof, please continue, then I will join in the meantime.
Okay.
Okay, sure.
Okay, thank
No,
you very much.
Professor, I
So,
cannot
can you
see
see my
your
slide?
slide. No, unfortunately, no.
Oh, no, but I already shared. Okay, let me try again. So, I click the share button, isn't it?
Yes.
Now, okay, can you see the? Still, you can't see, yeah?
No, no.
Mr. Shiva, I don't
Yes,
know
I can't
why.
see. It's not appearing. Once you click share, you need to choose the
What's the
presentation
reason?
and click on it. Yeah, click on it. Once you press share, you have to choose the
So,
presentation, click on it.
click on share.
Click share, then you appear the presentation which you're going to
Click share.
show. Click on it. Yes.
I click on share. Okay. So screen 1 and screen 2. Okay, screen 1.
Your presentation is screen, which screen? You see the presentation title, then you can click on it.
I'm clicking, but it's not.
Oh,
Okay, ready. Do it again.
it's there. Yeah.
So how is it now? Still
It is there.
is
Thank
there.
you. Thank you. Yeah, yeah, sure. We can see it. Just give it a bit of time. Can you just share the presentation? I think you've, yeah.
I think
Professor, could you kindly make it full screen if possible? Yes, better.
now.
Better, yes.
Okay.
Please start.
Okay. Sorry for this disturbance. Anyway, so here is the front view of our university. University of Cyberjaya is one of the world-class university and one of the topmost university in Malaysia. Okay, so let me go into the university. Yeah, so we'll get inside the university, so have a short journey. Before that, let me tell that time higher education impact ranking. This is the one type of world ranking for the university. Accordingly, we are in at 601 position. This is the ranking in throughout the whole world. So our university is not a very old one. I told before some time that we just started from 2005, and from that time till this 17 years, we already gained this 601 position. This is a good ranking. And now I will have a short journey through the video through our university, and we'll see how our university, the library, the classroom, the practical session are there. But before that, one important point I should mention, our university is mostly focused on the health science. Most of our faculties are on health science. We are focusing majority in the health and especially the MBBS and postgraduate program. And that is one opportunity for students to get and to learn a detail about the health science in our university. So let's start this short journey. And we have seen the huge number of collection of different journals and books as well, and the classrooms, big classroom sitting arrangement, practical sessions. We have got the laboratories, and all these facilities are there. Of course, the cafeteria is a highly sophisticated one. This is, we are actually a 5-star university in Malaysia, because in Malaysian higher education, Ministry of Higher Education, they give the star depending on the quality of the university. So we are already at 5-star, and it means excellent university. Only a few government university in Malaysia scored 6-star, only few, and next to that we are at position 5-star. So definitely it is a very good university, world-class university, and the students here will get a very nice education. And this university 5-star has been given because of some criteria which are watched by the Ministry of Higher Education. Number one is the employability. Employability means after passing from our university of University Cyberjaya, almost 100% of the students who passed from here get the job throughout the country as well as worldwide. And there are a lot of facilities in our universities, including the inclusiveness as well as teaching quality. So depending on these qualities, depending on this criteria, Ministry of Higher Education always give the ranking for the university. So we are in the 5-star. Here we call it 5-star. Okay, so student population, this is the mostly we are health science university, and we have got different faculties related to the health science. Especially we are concerned with the MBBS. At this moment in MBBS program from year 1 to year 5, we have almost 900 students in the MBBS program. And other than this, you can see here in the foundation course or in diploma, there are more than 1,700, and in degree other than MBBS, including the MBBS and other faculties, in total nearly 1,800. And we have also a very rich postgraduate section at this moment, and we have a good number of postgraduate students. At this moment, it is nearly more than 400. This statistics in 2019. So at this moment, it is much more than the previous one, of course. So this is the 2019 statistics. Now, our program, as I told you, mostly on the health science. Of course, the foundation program is the equivalent to HSC, higher secondary school, HSC level. So in Malaysia, most of the universities, they have got this foundation program, means the HSC level program. It is after the matriculation. So here the students choose their subjects. If they want to go for the medicine in future, they have to take the subjects related to the medicine like biology, chemistry, and physics or mathematics. So these are the foundation program, and in University of Cyberjaya we've got this foundation. And next we have got the different health and allied health, the medicine, pharmacy, then psychology, physiotherapy. All these are health related. Only one I can see here, business administration. This is not health related, but all others are program related to the health science. And that is a good thing, is that we focus mostly on the health science, so we are able to give the students full value of the health education. Okay, now I, as the one of the important thing, the entry requirement, but this is for the foundation program, not for the MBBS. I'll tell the entry requirement for the MBBS program later. So this is for foundation program is HSC level, and you can see here for MBBS students they should have all these subjects, minimum 5 subjects: biology, chemistry, physics, mathematics, and any one more subjects. And this subjects they have to complete the B grade. In B grade, then they will be compatible for enter into the MBBS course. Now, as I told you that Cyberjaya University is located in a very nice city in Malaysia, and that city is called the Cyberjaya. Cyberjaya means smart city, and really the Cyberjaya is a smart city. I'll take you all short video to go through the Cyberjaya city, as well as some other very important cities in Malaysia. And I hope here you can enjoy the different hospitals where our medical students will have the clinical studies. Okay, so I think you enjoyed a lot of the Cyberjaya city, as well as some other cities nearby where the different hospitals are located. Okay, next, I would like to say about our Faculty of Medicine in University of Cyberjaya. It is one of the topmost medical school in Malaysia, because our university degree is recognized by so many foreign medical council, like you can see here, Medical Council of India, Bangladesh Medical and Dental Council, Maldives Medical Dental Council, Jordan Medical Council. Still, some more few countries, especially from Middle East, we are working with them, and very soon they are going to give the recognition of our bachelor degree. Next, I want to introduce our Vice Chancellor, Honorable Professor Dr. Muhammad Abdul Razzaq. He is a very renowned person in Malaysia, very senior person. Basically, he is an orthopedic surgeon and specialty with the spine surgery. He is very renowned figure, and he has got 7 gold medal and 4 silver medal for his health activities. So he is very renowned person. Next, we'll show our Dean of Medical Faculty. He is a retired Major General, Professor Dato Muhammad Jin Bidin. He is a very nice person, but very strict. He is a retired Major General, and he's so in the Army Medical Corps. To get the promotion up to the General or Major General, it is really a tough thing in Medical Corps, but he is one of the person having this rank in his service life. And he is the founding dean in one of the renowned university in Malaysia, that is National Defense University of Malaysia. Actually, he founded the medical faculty in that university. Later on, he has joined in our university here, University of Cyberjaya, and he is a very strict person, but very my dear person. And under his proper guidance, our medical faculty is running very smoothly, and he is a very friendly person to all of his colleagues. Now, the most important thing which actually you want to see is the entry requirement for the MBBS course. Here, I should say, actually, for Bangladeshi student, they are coming either from the HSC level or from the A level, advanced level. So if it is from the HSC level, they must have these subjects, biology, chemistry, and either physics or mathematics. And they must have A grade in all these subjects, minimum A grade, all these subjects. Or if they are coming from the A levels, they can have either 3B, triple B, that is all the 3 subjects, either biology, chemistry, and then either physics or maths. 3B, or they must have ABC, but they cannot have 2C. If 2C, then it is not allowed here. So if 1C and other 2A or other 2A and B, this is okay. So these are the entry requirement for the MBBS course coming from Bangladesh. Our university is not only a course curriculum university. You have got a very good number of research clusters, and so many research work are going presently in our university, and most of these research works are health related science, like pharmacological science, cardiovascular science. You can see this is a very, very important thing. And among this, one important thing is that this disaster and emergency in other university in Malaysia, this research work is very minimum or maybe not at all. But in our university, this cluster is there, and this disaster is very common in Bangladesh. So I think this might help our Bangladeshi student a lot. Okay, then okay, so this is a short statistics about University of Cyberjaya. That statistics is on 2017, and here you can see 2-star for the research activities. Then during that time, 2017, we have got in 1 year, we have got 105 papers published in Index Medical Journal, and other than this Index Medical Journal, another 95 papers were published. Okay. Then citation of our university research work, citation was nearly 1,000, and this is very good position. And our university, the academic staffs, more than 84% are professionally, they are qualified, either PhD, doctorate, or masters. So this is very, very good position of our academic staffs. And you see the research grant from the Malaysian government in 2017, it was nearly 500,000 Malaysian ringgit. That was in 2017, but presently it is nearly 1 million Malaysian ringgit for the research grant in our universities. So Malaysian government is always encouraging the different universities for research working. So they are giving the grant for this research work. Now, I would like to have a overview for our MBBS curriculum. Our MBBS curriculum is 5 years program of course, like in Bangladesh, but the difference is that our curriculum is outcome based, because we make the students sure about the learning outcomes. What are the learning outcomes will be there, and we teach and we let them learn about all the topics which are depending on the outcome. And our learning and teaching and learning is integrated. Integrated means from the first year, very first year, the student will start to learn about the clinical condition, not like in Bangladesh, that is the classical one. Usually in Bangladesh, what we used to learn in year 1 and year 2, we learn only the basic medical subjects. We don't have any clinical, but here in Bangladesh, the students will start learning the clinical activities, the clinical things from the very, very first year. So when they learn the basic medical science, definitely they have to come in contact with the clinical condition related to this basic medical science. Here you can see the in year 1 and year 2 in our university, we have got the basic medical science, but as I told you, it is not only the basic medical science, it is also related to the clinical co-curriculum as well. You see, clinical correlation along with this basic medical science. So this is for year 1 and year 2, and year 3 and year 4, junior clinical clerkship, and in final year and year senior clinical clerkship. But in year 3, 4, and 5, they are mostly touch with the clinical curriculum, but even that they have to go through the basic medical science during this year 3, 4, and year 5. So they cannot forget the basic medical science, even in the clinical years. Now, in our universities, the teaching learning methodologies. So here, these are the teaching and learning methodologies. We are not only giving the interactive didactic lecture. We have got the problem-based learning. We make some clinical scenario for the diseased patient and give to the students, and the students, they themselves have their brain work, brainstorming, and they find out the finally they find out the diagnosis, and they also find out the management, clinical management. So this is problem based. So team based, another important thing is team based. They learn in group, in a small group of 5 or 6 students together, and they sit together and they learn, and the lecturers of course will be around. If the students feel any problem, they can ask or seek help from the lecturers. Here the lecturers are only the facilitator, they are not giving the lecture. Then task based learning also, that is another important one. There is we usually give them the assignment, and the students have to do the assignments in proper way, and finally we the lecturers evaluate it. And this is below you can see the practical different ways how we do the practical classes. So we have got the wet laboratory and dry laboratory both, and the students they learn hand on. And other than this, we also students can learn about the computer assisted, because nowadays so many facilities are there in computer, so they can learn in computer assisted simulated laboratory. During the year, the year 3, 4, and 5, they have got the posting in the different hospitals, and they have to go to the bedside and they have to learn there. So that is the practical clinical teaching. And this type of teaching actually help the students for lifelong learning. And now you see last 3 years, as there was the COVID situation, and most of the university they could not take the face-to-face session. So that time we used to have the e-learning system. So in the e-learning, we have got the several modules, like LMS, the learning management system, Microsoft Team, and Zoom. So these are the different facilities where we can go for the e-learning system. And one important thing is that is the advantage actually e-learning system. Usually it is recorded, and this video we usually send to the students later on, and the students can watch this video several times, and they learn the watching the video very nicely. Okay, and for the practical sessions, from the very beginning, first year, the students have to do some clinical activities. Usually, and in Bangladesh, I have seen the clinical activity starts from the year 3, but here in Malaysia, we start the clinical practical activities from year 1. Actually, year 1 and year 2, usually we use the mannequin or dummy patient, so that in this short video you can see how we conduct this clinical session in the preclinical year 1 and year 2. So you can see here, usually what the clinical students in year 3 and 4 and 5, they do on the real patient in the operation theater. Here in Malaysia, in year 1 and year 2, the students also doing the same thing, but on the mannequin and the dummy patient. Now, after having the degree from our university, we let them to expert in with the knowledge, then practical skills, so they can have their own thinking and scientific skills, communication skills. This is one of the important thing. We teach the students how to communicate with the patient. Then they have to know the social skill and responsibilities in the societies. All these things we give them to learn for learning. And another important thing, we are very much careful about the ethics and professionalism. Then this will help them for the lifelong learning. And our students, after passing from here, not only go for the job, but they themselves create the jobs also. So that is another important thing in our learning system. Now, MBBS program system, you can see here, year 1 and year 2, we have got 4 semesters. Year 1, there are 2 semesters, and year 2, there are 2 semesters. In this 4 semester, they complete the pre-medical. Then in year 3, they start the clinical phase, junior clerkship in 3 and 4, and the senior clerkship, clinical clerkship in year 5. Now, in year 1, you can see we have got this program in year 1 semester, foundation block, behavioral science, general anatomy. So these are the all in semester 1, and semester 2 also in the year 1. We go for this system, or we can say the module, or we can say the block. So we complete these blocks in year 1. Then in year 2, so in this way, we complete all the basic medical science, and then they go for the first professional examination. And after that first professional examination, they are promoted to year 3. So in the year 3, they start the clinical rotation, and also in year 4, they continue the clinical rotation. So the clinical rotation in the different hospitals, in the renowned hospitals in Malaysia. And this, after this year 3 and year 4, they go for the year 5. And again, here in year 5, they are having this clinical posting by rotation in different hospitals. And one thing I like to mention here, our students usually go for the different government hospitals in Malaysia. Most of these government hospitals are located in the main cities, and these students never need to go to the most periphery for the less important cities, because we are selected the hospitals mostly located in the big cities, so that the students, they don't have any language problem with the patient. Because if they go the remote area hospital, maybe the patients, they don't know they cannot communicate very nicely with the doctors. So sometimes that makes a very big problem for the foreigner students. But fortunately, our hospitals are all located mostly in the big cities. So most of them cities, the patient, they can communicate very nicely with doctors in English language. That is the one benefit for our university. Now, in total, our MBBS course, we have got the total score for the MBBS 206. Here you can see the divided credits in semester 1, semester 2, up to semester 10. 10 semesters, we have got this divided scores. And Total credit is 206. And as I told you, our hospitals are mainly located in the major cities of hospital, Kuala Lumpur, Cyberjaya, Putrajaya, and Shalom. These are all big cities, and all the patients here, hopefully they can communicate with the doctors in English. That is very good thing for our university. Now, this is the Google map to show the Cyberjaya hospital here. You can see the Cyberjaya hospital, and our university is here near. It is almost walking distance. If you go on walking, it takes 20 minutes. So very close to our university. And also the hostel for the students are very close to the university, and it is walking distance also. Even that, we have got the shuttle bus service from the hostel to the university or to the hospitals, so the students can avail the bus service of the university itself. Now, the lecturer and student ratio, it is very, very good position in our university. You can see here, overall, the ratio is 1:4.3, means for students, there is one lecturer. So that is, if you consider the preclinical only, that is 1:8. And if you consider the clinical sessions, 1:3. So an average is 1:4.5, something like this. So our academic staffs are good number, and students can get the full benefit. When the students are in the clinical years, they have to go to the hospital, and every one students will be given 5 bed, and so that is also another good opportunity. So each students, when they are posting in the different clinical subjects, one students will look after 5 patients at a time, and that is a big opportunity for the students to learn the clinical conditions, clinical situation. So here I am almost at the end, and I think I have taken a lot of time. So next I let you allow to go for the question and answer session, please. Thank you. Thank you, Sharja. So let me stop.
Thank you, Professor. Thank you for your detailed presentation. Yeah. Thank you so much for your presentation. And that was a very detailed overview about the MBBS program at University of Cyberjaya.
Now, want to say something?
Yes, okay. I wish to, I'm very sorry, first of all, because of some technical errors. Okay, dear students, regarding the intake, we have only one intake in a year, which is October intake. So, but don't think that you have a very long time to apply, especially those students who are coming with the HSC results, where you need to have IELTS qualification. Okay, so please apply immediately, because our seats always gets full. Okay, our seats for the MBBS program for this year, we have 210 seats, and for international seats are very limited. And also we are having a very attractive scholarship. Okay, if you want to know what is a scholarship, then our sister Sharja is here, able to assist you on the scholarship. Okay, only going through them, you're able to get a very attractive scholarship. Okay, so you need to check what is the documents, eligibility criteria, and then intakes. Okay, please apply as soon as possible before our seats gets filled up. Okay, so that is from me, and if there's any questions, then we can discuss about this now. Thank you.
Thank you, Shiva. Thank you for kind words. I think Professor have actually covered all the aspects that the student needs to know about the MBBS program at University of Cyberjaya. So I just have one question to Professor or Shiva, if you'd like to drop in. Like, there is an interview that the student needs to go through during the admission process. So what are the interview questions like, and who's going to take the interview? How long will that be? So if you could kindly give us a brief overview about that.
Okay, for the interview, actually, the Malaysian students, they have to face the interview, but this interview is not like that interview, what we are thinking. It is not like that. That is, we are asking the question from the biology, chemistry. No, it is not like that. Actually, the interview mostly focusing on the psychological condition of the students. Means if the students are interested to learn the medical science or MBBS really or not. Sometimes, our parents push the children to go for the MBBS study and to be a good doctor and something like that, because doctors are very important in the society. So we make sure if the students himself or herself is interested for this degree or not. That is very, very important. That is mostly point we usually confirm during the interview session. Thank you.
Okay. Thank you. I think that's all the questions that I had, and that too from our viewers as well. Thank you for your time today, and those who are watching us live. As Mr. Shiva mentioned, that the seat for the MBBS program at University of Cyberjaya is limited for international students, and they only have one intake in a year. So those who are still, the SHO result just came out on 13th of February. So those who are still thinking about applying for the MBBS program at University of Cyberjaya, which is a BMDC approved program, approved program. So would highly encourage you to apply way before time, so that your enrollment and your places at the university is confirmed. Thank you all for joining us today. We'll be dropping you our office address. And
one thing, Sharjah,
yes.
let me explain one thing more.
Sure.
Actually, in our university, not only in our university in Malaysia, all the universities in Malaysia, after finishing the MBBS degree, the students, the newly passed doctors, they go for the housemanship in hospital.
Yeah.
Housemanship in Malaysia is equivalent to internship in Bangladesh. So in one thing I would like to make sure that here in Malaysia, only the Malaysian students are allowed to do the housemanship. No, not any foreign students are allowed to do the housemanship in Malaysian hospital. So all the foreign students who will be passing MBBS in Malaysia, they must go back to their own country and they have to do their internship there. And then it will be completed. Otherwise, it will not be complete. And for that purpose, suppose some students would like to come from Bangladesh, they must talk to BMDC before coming here. If the BMDC will allow them to do the internship in Bangladesh after having the degree from the Malaysia, because Malaysian degree is recognized by the BMDC. Even that, the students better to have a talk with the BMDC before coming here. Thank you.
Okay. Thank you for clarifying that. So thank you for everyone. Thank you everyone who have watched us for some time now. And those who are interested to apply to University of Cyberjaya, please do get in touch with EDUKO Pathways Bangladesh, as because we represent them directly here in Bangladesh. And if you have any queries, do feel free to text us in our Facebook page. We'll be answering them as early as possible. Thank you, Dr. GM Kibriya. Thank you, Shiva, for joining us today. Thank you for your time. Until then, see you next time.
Thank you.
Thank you. Dhanyabad.
Dhanyabad. Yeah.